their police department, and in my case, their fire department, is absolutely here and ready to respond to their needs and their emergencies. And we are very appreciative of the support that the community is continuing to provide us and the outpouring of support that they have provided us as this pandemic developed. The roughly 300 men and women a day that are staffing the stations across Montgomery County of Montgomery County Fire Rescue are faced with a very complex situation as we see our call volume picking up. We had seen a lower than normal rate of call and emergency activities for the first several weeks. And we see that returning to about statistical normal now. And we are also seeing about a 5 to 6 dozen cases of members in the community with viral symptoms on a daily basis. Those that have a fever, those that have a cough, or may have already been tested for COVID-19. And each of those calls requires a different level of personal protective equipment from our members. And those calls are time consuming, which is what is our men and women are faced with. The opportunities for helping our communities are in line with and help follow those health instructions by Dr. Gales, the folks from Department of Health and Human Services, Public Health, and the CDC, helping the folks use a traditional cloth mask as an example when they're out in public for everybody's protection. But more specifically, community needs to understand that to keep the men and women of the department safe, we transitioned a couple weeks ago to all of our personnel on every call, be it a car accident or an injured person with a broken arm or somebody who has a heart attack. We are now wearing surgical procedure masks on every incident that we're out and engaged with the community. We're wearing these masks, and these are medical masks, and it's utterly important that the community recognize the medical mask, procedural or an N95, is reserved for your healthcare professionals. The men and women of Montgomery County Fire Rescue are keeping themselves healthy, keeping their families healthy, keeping their facilities safe and clean. And to do that, we had to limit community engagement with our members. So there's no more station tours. We limited all of our community outreach activities so that the community stays healthy and our members stay healthy. One component of our health is the ability to early detect the symptoms, the fever, the cough, the other components related to these viral syndrome that we're dealing with. And as a point of information that we want to share on this call, the Montgomery County Fire Rescue recruit class, which was in session and processing through, had been in session since December. We had a situation develop this week at our training academy in which 3 recruits became symptomatic. And as of yesterday, the recruit class and their support personnel have been sent home and implementing a self-quarantine circumstance. So that is the 47 members of the recruit class and the 7 instructors for the recruit class. In conjunction with Chief Jones, Captain Katonis, Assistant Chief Sanford, who is the Fire Rescue Training Officer, we're working together with the Department of General Services to implement the process of having the academy cleaned and circumstances there to support the operations of what is our joint public safety training academies. So a component that we've anticipated, we have planned to address staffing adjustments or the need to adjust our service delivery. And we anticipate the next week to 3 weeks being our surge to be times that will be demanding for us. as the community needs us more than ever before as the surge hits Montgomery County.